Cancer means that the cells are growing uncontrollably. The cervix is the lower part of the uterus, also called the mouth of the uterus in our local languages. So cancer of the cervix is when the cells around the mouth of the uterus become uncontrollable. Cervical cancer is the fourth most common cancer among women in the world, and it's the leading cause of gynecologic cancer death. Almost over 80% of women will present to the hospital when it is too late, when it is end stage, third or fourth. Cervical cancer is caused by a virus called human papilloma virus, or HPV. This human papilloma virus affects the cells of the cervix and causes changes. These changes do not happen at once. It takes a time, and then the cervix undergoes changes that later lead to cancer. HPV is sexually transmitted. This means that someone acquires this virus by having unprotected sexual intercourse or sexual contacts with someone who is infected with the human papilloma virus. Typically, when the body is exposed to the HPV, the immune system of the body tries to fight it and clears it. So you develop cancer when the body is unable to fight this virus. Then the cells undergo changes, and then you end up getting cancer. The people at high risk of getting cancer are those who have multiple sexual partners, the people who give birth to many children, the people who start sexual intercourse early in life, people who are immunosuppressed, like those who have HIV, those who have diabetes, those who have other cancers or other conditions that cause the immune system of the body to weaken. Most people will not know they have cancer of the cervix. They'll be what we call asymptomatic. In other words, they have the virus, it's causing changes in the cervix, but they can't tell. So that's where most people fall. The other group of people might have bleeding during sexual intercourse, bleeding in between the periods, or having a vaginal discharge that sometimes becomes foul smelling. Some people will get pelvic pain during sexual intercourse, or just pain. As the cancer grows, some people might feel a mass, a feeling of a mass within the pelvis. So when someone feels like that, most likely the cancer has grown. So the young girls, avoid sexual intercourse early in life, because during the teenage life or during adolescence, the cervix is undergoing some changes, and this is when the cervix is most prone to getting the human papilloma virus, and hence the changes that lead to cancer. Pregnancy, this one people want to give birth, but the more pregnancies you get, the higher the risk of getting HPV, and hence cervical cancer. The smokers, every time you smoke, the nicotine affects the cells of the body, and hence makes it difficult for the body to fight the human papilloma virus. So we have screening methods. Screening methods will help us detect the smallest changes in the cervix that might lead to cervical cancer. There are many screening programs going on in Uganda, and at Mildmay Hospital we offer cervical cancer screening. It can be by VIA, or visual inspection with acetic acid. There you get the results immediately. It's either positive or negative. When it is positive, it doesn't mean you have cancer. It means that your cervix is undergoing changes. And this can further be investigated to rule out the cancer or confirm the cancer, and then treatment can be given. Number two, we can do what we call a pap smear. A pap smear takes around 1 week to 2 weeks to get the results, because we get some cells from the cervix, and these are analyzed in the lab. Then we get the results. The third is a DNA test. So the DNA test normally checks for the virus the human papilloma virus. Of course, there are different strains of the virus, and these different strains are the ones, there are some that are responsible for the cancer, others are responsible for other things. So the DNA test, albeit expensive, it offers us a clear, picture of what kind of virus, what strain of virus we have, and hence treatment can be given thereafter. People can be immunized for cervical cancer, for the human papilloma virus, the virus that causes the cervical cancer. Currently in Uganda, we have programs that immunize young girls from 9 years up to 21 for the strains, the high-risk strains that cause cervical cancer. Immunization helps to boost the immunity of the body to fight against the HPV. So the body is prepared to fight. Someone might ask, if I've already had sexual intercourse, can I also have the immunization done? Yes, you can, but if you have been exposed to the HPV, you will not get protection that we want you to get from the immunization. Here at Mildmay Hospital, we offer cervical cancer screening. The procedure is not as complicated as most people put it. Women are scared of coming to hospital to check because they think they'll get pain, but it's not supposed to be painful, okay? So we have the VIA, that's the visual inspection with acetic acid. We also do pap smear. So I encourage you to come to Mildmay Hospital and ask for cervical cancer screening. Every woman above 21 years should have this test at least every 3 years. If someone has immunosuppression, or they have HIV, or they have conditions that cause their immunity to be low, we test every 1 year. And this will help us to detect the smallest changes in the cervix and then offer treatment before it is too late.